Hi guys, welcome back to my channel 32 Happy Teeth. Recently I have been posting videos of prosthodontics, but today we will be studying pharmacology, particularly central nervous system. So let's start with the sedative hypnotic drugs. So sedative hypnotic drugs. First, let us understand what is a sedative and what is a hypnotic. Sedative is a drug that calms a person. Suppose a person is it's panicking or is undergoing anxiety, some sort of anxiety, so you can give a sedative to a person so that to calm that person condition, that his emotions or her emotions. Whereas hypnotic is a drug that induces sleep, that makes you sleep, whereas sedative calms a person, hypnotics lets the person sleep. Okay, now let's move on to the next slide. So now let us understand what a CNS depressant drugs do. CNS depressant drugs can produce sedation. Sedation we have already studied in the previous slide. That is, it induces, it calms a person down. Hypnosis induces sleep. Anesthesia, we all know what anesthesia is, and coma. So depending on the dose, CNS depressant drugs can either sedate a person, hypnotize, or even anesthetize, and can also take them into the coma. So the major group of drugs useful for the treatment of insomnia. So now we are done with CNS depressant drugs, what all they do, depending on their doses, what all they can lead to. But what about insomnia? If a person is suffering from insomnia, what is the line of treatment? So there's a group of drugs that help insomniac patients, that is barbiturates, benzodiazepines, and some newer drugs. So we will be dealing with all the drugs, the group of drugs one by one, and understand how they act, where they act, and what is their mechanism of action. Now let us move on to the next slide. So Gaba A, B, Z, D chloride. This is a channel complex. Channel is a passage where something can move to and fro. And complex, why is it called complex? Because it consists of 3 units, that is Gaba A, BZD, and chloride. And it is an ion channel. And what is this channel like? What does it do? So when it opens up, this channel opens, there is increased conductance of chloride ions. And what happens because of this increased chloride ions conductance? Yes, it leads to CNS depression. Now we know how CNS is depressed. That is opening of this channel complex and leading to the increased conductance of chloride ions. So if you want to treat CNS depression, you have to give certain compounds that can interfere, or you can say modulate, the effect of this channel. So in the upcoming slides, we will be learning about these compounds one by one. So this GABA, what does it do? This GABA directly binds to the GABA A receptor site. And when this binds to the receptor site, it increases the duration or time period this ion channel complex remains open, leading to increased conductance. And GABA C receptors are present in retina and are inotropic, mediating influx of chloride, similar to GABA A. We have studied that GABA A was an ion channel and it is a complex because it is associated with BZD and chloride. Similarly, GABA C is present in retina and they are inotropic, mediating influx of chloride. Whereas GABA B receptors are G protein coupled receptors. Okay, so what happens is it increases the duration of channel opening by directly binding to GABA A. Now let us move on to the barbiturates. Now coming to the barbiturates. Barbiturates actually they bind to another site on this same very channel. So this channel complex on the opposite side, on another side of the same channel, barbiturates bind. And what do? They basically have 2 functions, GABA mimetic and GABA facilitatory. So GABA facilitatory, what do you mean by facilitatory? That is, it increases the binding of GABA to GABA A receptors. So GABA is going to directly bind to the GABA A. And what is barbiturates doing? It is forcing, or you can say in simple language, it is pushing the GABA to go and attach to GABA A receptors. And the second action is GABA mimetic. Mimetic is like it is mimicking GABA. That is, it leads to direct activation of GABA A receptors. So facilitatory, it pushes the GABA to go to GABA receptors, and GABA mimetic is like it causes a direct activation of GABA A receptors. Now let us move on to the benzodiazepines. So now coming to the benzodiazepines bind to a different site, that is BZT receptors, which is present on the same channel complex, GABA A BZD chloride channel complex. Now GABA is going to bind to the GABA A receptor, barbiturates is going to facilitate that action or even mimic that, and benzodiazepines, it binds to BZD receptors. And what it does, it also has this GABA facilitatory action similar to barbiturates. Thus it will increase the binding of GABA to GABA A receptor. Hence what these drugs will do, so these drugs will increase the frequency of chloride channel opening. So they will increase the number of times this chloride channel opens. Now let us move on to another drug. Now coming to another drug, that is bicuculline. So where does this bicuculline binds? It binds to GABA A receptor, and it is actually an inhibitor of GABA. So inhibitor of GABA, that it is competitive inhibitor of GABA, whereas it is non-competitive inhibitor of benzodiazepines. So it is actually inhibiting GABA as well as benzodiazepines, but in case of GABA it is like a competitive inhibitor, whereas in case of benzodiazepines it is a non-competitive inhibitor. Now let us move on to another drug. What does this beta-carboline do? Beta-carboline acts as an inverse agonist at benzodiazepine site. So beta-carboline is acting at benzodiazepine site and it acts as an inverse agonist. So what does this lead to? This leads to stimulation of the brain, which ultimately leads to the production of convulsions. So beta-carboline acts as benzodiazepine site, inverse agonist, leads to stimulation of the brain, resulting in convulsions. Now let us move on to the last drug of today's lecture, that is phlomazine. So phlomazine acts as a competitive agonist at benzodiazepine site. Now what does it do? It actually inhibits the actions of benzodiazepines as well as beta-carboline. Why? Because it is an antagonist, hence it is inhibiting the action of benzodiazepines. But why beta-carboline? Because if you remember in the previous slide we said that beta-carboline is actually an agonist. So since it is an agonist at benzodiazepine site, so beta-carboline will also be inhibited by phlomazine. Till now we have discussed in total 6 of the compounds that modulate the effect of this channel complex, that is GABA A BZD chloride channel, that is GABA, barbiturates, benzodiazepines, butyroculline, beta-carboline and phlomazine. With this, we come to the end of today's central nervous system topic, that is sedative hypnotic drugs. Consider joining my Telegram group if you are a NEETMDS aspirant, or if you want to solve some MCQs. I conduct weekend quizzes every weekend on my Telegram channel. And yes, if you find this video helpful, then please like, share and subscribe, and don't forget to hit the bell icon. Till then, take care. Bye-bye.